when the H1N1 hit, I was shipping boxes and antibiotics and PPE from my stockpile warehouse to Callan J&B, who was receiving it and deploying it for the city of Chicago.
The pharmacist there in Chicago said, "Wayne, we need your help." That was on October 5th. We were fully operational on October 9th, and we did 16,000 doses of the H1N1 vaccine on that day.
We actually got reports from the White House every day about which project areas needed more supplies. It was an honor to do it.
We have a contingency contract here in Texas, which during COVID was activated, and we basically managed over 12,000 sites within the state of Texas delivering vaccines, the testing equipment. Oregon was so impressed with our process, they said, "We want you to do it up there."
At the height of the pandemic, we were controlling the COVID assets for 30 million Americans. Scott and myself flew to Chicago to consult with the deputy director of the Chicago Department of Public Health to plan out the response to the crisis.
When we were here doing 10,000, 12,000 shots a day, hitting the ground in 2 days after getting the call.
My entire staff was listed by the governor's office as mission critical, receiving anywhere from 100 to 150 tractor trailers on a daily basis of equipment.
I'm pretty sure that I worked 127 hours in 1 week, but that's what we were there to do.
We played a critical role in the city of Chicago's response activities to Mpox, from pushing vaccine, medical, ancillary supplies, and so forth to their clinics and hospitals where or when needed.
They came in, brought over 200 soldiers in to learn our logistics process. We trained them on how to work with the push package, how to use our IMS, all in 1 weekend. The stockpile sent 2 representatives to observe, and they told us that not only were we the first project area to drill with their National Guard, but this was the best run facility that they had seen.
Stockpile knew about us. We had already been approved to receive all of the COVID vaccine, so it was very easy for them to just ship the monkeypox vaccine to our 3 facilities where we manage that for these regional areas. We're constantly in that preparation and preparedness mode, and that continues today. You know, when Ukraine war started off, I mean, they were reaching to us for solutions. So we partnered with an organization, we developed a medical response drone and transported those over to Ukraine.
We were utilizing the drones and the green boxes to drop meds and emergency materials in austere locations where there was threats to personnel, or you just couldn't get there because bridges were out, roads were out. Wayne has been there at least twice, helping them and training personnel here in the States to do search and rescue and to identify and find IEDs and other threats.
So if technology which was supposed to deliver vaccines can help find these destructive things, I'm all for it. From that, you've got EMS, you've got fire, police, they're all looking at this thing saying, okay, this gives us a tool to deliver that life-saving medicine. So those are the type of things that this company looks at. How can we constantly add to the services we already provide to the customer to help them in that emergency?